Hi everyone, my name's Lily and I'm going to be your webinar administrator today. Before we get started, I'd like to share a little bit about Community Health Resource Center. We are a nonprofit here in San Francisco. We were established nearly 40 years ago by doctors at California Pacific Medical Center to provide resources and care that would supplement their work with patients. Today, we provide 4 main areas of service: social work services, nutrition counseling, health screenings, and health education. Today, we will have a culmination of 2 of our areas of service, which are nutrition and health education. Today, you'll meet a provider from our nutrition team, Elena Zidaru. Elena is a registered dietitian and the director of our nutrition team. She is passionate about working in the outpatient setting and supporting her clients achieve their health goals. She provides individualized nutrition counseling for weight loss and disease prevention, but also provides nutrition therapy for people with various medical conditions, such as cancer, diabetes, chronic kidney disease, gastrointestinal disorders, cystic fibrosis, and more. Elena also provides nutrition therapy for cancer patients going through chemotherapy at the Brian Hemming Cancer Care Center or radiation treatment at the CPMC Radiation Oncology Department on an as-needed basis. Her goal is to meet her clients where they are in terms of readiness to change and help them set goals that are realistic and achievable to promote self-efficacy in achieving health behavior change.
Thank you. And again, once again, I'm Franco Reyna. I'm with the National Kidney Foundation, along with a couple of my colleagues from our organization, Doris Liu and Celine Ko, who have been my partners in crime, so to speak, in this wonderful collaboration with the Community Health Resource Center of San Francisco. I just had a few words to say. Just want to thank everybody again for coming back, because this is a wonderful second session where we actually get into the nitty-gritty of nutrition and specifics about how you can manage and control some of your current conditions and hopefully manage more succinctly and better, in a better way, your chronic kidney disease from any origin. Again, we'd like to thank our wonderful sponsors, Horizon Therapeutics. And with that, I'll pass it along to the Elena so she can get started on her wonderful information and presentation for today. Thank you.
Well, thank you, Lily and Franco, and thank you all for coming back this week, the second week, when we're going to talk about nutrition. Excited about this kind of entire hour and a half focus on nutrition. And next week also, just as a reminder, we will have still more about nutrition, more concrete ideas for meal planning on how to put the information that you're going to hear today into practice. We're also going to have a speaker that's going to talk about plant-based diets and how that can help manage CKD from his own experience as a doctor. So I'm excited about his talk too. So I'm going to share that the last week. Next week, it's going to be a shared presentation between me and the guest speaker. So without further introductions, this is the class outline. We're going to talk about benefits of nutrition at any stage of CKD and some nutritional considerations for certain nutrients like protein, sodium, potassium, phosphorus, and others. So basically, we have the evidence that medical nutrition therapy for CKD improves biomarkers and slows time to dialysis. And this is from 2016, the Journal of Renal Nutrition. And those results of the study suggest that people with CKD who received the medical nutrition therapy were less likely to start dialysis and had improved nutritional biomarkers than participants who did not receive that nutrition component. Nutrition interventions also demonstrated improvements in glucose and blood pressure control, which, remember, I said some of the main causes of CKD would be diabetes and uncontrolled diabetes, uncontrolled blood pressure. So basically, nutrition counseling can help also with managing better blood glucose and blood pressure, and this way helps also slowing down the CKD progression and delaying the need for dialysis. Now we have more and more evidence, and you're going to hear a lot today about this, and next week too, that eating more and sorry for misspelling, it's plant-based diets, not plant-based diets. So eating more plant-based diets may help prevent and slow the progression of CKD, type 2 diabetes, high blood pressure, and cardiovascular disease. And as I said, they're all kind of tied into kidneys health. So, but what I would like to kind of point out is that those plant-based diets are not routinely being offered as a treatment option by nephrologists. And it's not necessarily something that even if you do a Google search, you're gonna kind of find it everywhere. I think this year, and I'm excited about because I've been teaching this class for about 5 years now, and I could tell how much I'm actually updating those slides each year. In terms of nutrition recommendations. And I feel like we're still learning. And then even though there are lots of studies suggesting even, a decade ago that plant-based foods can be more helpful, can decrease the acid load in the body and can help the kidneys health. We also know that a lot of plant-based foods were not recommended for CKD because they might be high in potassium or high in phosphorus. I'm talking about legumes and nuts and seeds and whole grains, those plant-based foods that are healthy, right? And we perceive them as healthy, but they were more kind of, we're telling people to avoid them. So, there's a lot of, it's a big range in terms of, in the last 5 years, in terms of nutrition recommendations that I've been teaching those classes. And it's exciting in a way that this is what nutrition science is all about. We always learn and figure out things, and we may change recommendations as we go based on what we discover. So definitely, I think this is the first year where you're going to see more on my slides, this emphasis on the plant-based diets. And as I said, unfortunately, they're not necessarily routinely offered still as of today as treatment options. So hopefully we're going to change that, and let's see when we're going to be next year and the year after. But in general, nutrition therapy for CKD needs to be an individualized approach, and the recommendations should be based on each person's stage and other health risks. It's different if you're stage 3 versus stage 5 or stage 2 versus stage 4. It's different depending on the labs you're having, or if you have also diabetes or not, or if you have high blood pressure or not. So it's really what other comorbidities you have. Are you at a higher risk of cardiovascular disease because of other maybe family or lifestyle risk factors? So there's no really one recommendation. Sometimes people ask me, so what's the diet for CKD? And I really cannot answer that question without knowing a little bit more about that person, like what stage, what are the conditions, what are your labs look like. I can't really tell you the exact diet in a box if you just tell me what's good for my kidneys. So, but I would like to say one more time, and as I said, I will clarify some of those things as we go today through the presentation. I want to remind everybody that was here last week, some of the best things that you could do for your kidneys health is to control your blood pressure, especially if you have high blood pressure, and you control your blood sugar, especially if you have diabetes. So those are some of the most important things that you could do to prevent further kidney damage. And in terms of CKD and dietary patterns, so in adults, CKD stages 1 to 5, not on dialysis or post-transplantation, a Mediterranean diet or a plant-based diet approach may improve lipid profile. So this is something that we've had for a few years now. It was on my slides last year too. And then in adult CKD stages 1 to 4, again, this is more few years back kind of evidence that when you increase fruit and vegetable intake, you decrease actually the body weight, blood pressure, and the net acid production. So you're kind of decreasing that acid load that can be an issue when you have CKD. those are kind of things that we've known for longer time. And I have here this My Plate model of eating because I want to clarify what's a plant-based diet. A lot of people get confused about. Sometimes I talk with people and they say I'm on a plant-based diet, but they might be vegan or they might not be, and I'm not sure exactly if they understand what a plant-based diet is. So plant-based diet does not really require for people to become vegetarians or vegans unless they choose for different reasons. So veganism and vegetarianism, they're part of this plant-based diet bigger umbrella. But the plant-based diet does not refer only to vegans or vegetarians. So you could also eat, let's say, chicken or red meat, but it's kind of more the ratio of the nutrients on the plate that makes the difference. So we say 89% of the meals in a week, which would be all of them, with the exception of maybe one or two, if they're more than half plant-based, that's the definition of plant-based. In this particular picture here, you see 75% of your plate in between the starch and the vegetables and the salad. This is plant-based. So 3/4 of a plate or 75%, and just a quarter would be the animal protein. So this is plant-based. There's also a definition that it's more recommended by American Institute of Cancer Research, that they do a split of a third, a third, a third. So a third of the plate vegetable, a third starch, a third protein. This way you have 2/3 plant-based in between the starch and vegetable, which is 66%. And I think that's probably the cutoff where the plant-based is. So it's more than 50% plant-based for the majority of meals in a week. And then anything that's within kind of falls into plant-based. Like, of course, if you're vegan, that means you're 100% plant-based. Of course, you're part of a plant-based diet. But I wanted to emphasize you don't have to be vegan to eat on a plant-based diet pattern. I will also want to mention that you could be probably vegetarian, but may still not eat on a plant-based diet, unfortunately, depending on your food choices, right? Let's say if you eat a lot of eggs and dairy products, but you're not eating a lot of fruits and vegetables and grains and maybe legumes, and your meals are like, I don't know, a slice of bread with 2 eggs and a piece of cheese. I mean, that's not more than half of your plate plant-based foods. And let's say your most meals are like that. So I think it's more important to, to kind of separate ourselves from those terms and just kind of understand, the way I gave you a breakdown. So more than half of your plate for the majority of times should come from plants as a plant-based diet pattern. Now, we're going to revisit the nutrients of concern for CKD. We're going to start with protein. How much protein should I eat? And this is a big debate that I've been seeing CKD for many years, just going back and forth. I mean, they're not big changes. It's not to say that we start from like very low protein to very high protein. The idea is that less protein will put less burden on your kidneys that are not working as well already, because those waste materials from protein digestion and absorption, those waste materials kind of become harder to excrete by your kidneys that are not working as well. So I think there's no surprise that we can really say a high protein diet is good for your CKD, for sure not. But I think the debate and back and forth is like how much is too much, how little it should be, how less it's not actually increasing the risk of malnutrition and other kind of issues that can happen. So basically, low protein diet for CKD has been controversial for the last years, and with questionable benefits. We're not very clear how much it helps in terms of, we know it's helping, but at what level of low protein it actually helps the most. And then, of course, you have the risk of malnutrition, as I mentioned. It's also hard to follow a low or very low protein diet, right? We just tend to eat more protein. In a lot of studies that look at very low protein diets and low protein diets for CKD, they noticed that actually the adherence to the diet was pretty low. People were not really able to follow thoroughly those diets. So now the jury is still out, looks like, in terms of last year. If you participate in my class, I had the most updated recommendations. They were talking about low and very low, and those numbers were a bit lower than what we have here today, 0.6 and 0.8 grams of protein per kilogram per day. But until more well-designed randomized controlled trials are warranted to verify the efficacy of a very low/low protein diet, a plant predominant low to medium protein diet, so 0.6 to 0.8, with more than 50% plant-based protein sources is recommended for now. So again, we're more conservative. We're not telling people to eat a lot of protein. Low to medium, 0.6 to 0.8. I want to mention the 0.8 grams of protein per kilogram per day. That's the normal recommendation of a healthy adult. So actually our body, for protein needs, for immunity, for muscles, for, creating all kinds of enzymes in our body, because those are needing the protein that we eat. So they all use kind of amino acids to create those things in our body. So all those things require just 0.8 grams protein per kilogram per day. So we don't need to eat as much protein as sometimes we think we need, or sometimes we tend to eat. So 0.6 to 0.8, it's a more conservative approach. But the key here that's different this year compared with last year or past years is that it's with more than 50% plant-based protein sources. So last year, maybe I said, it seems like 50-50, it's good enough. We didn't really know of a split of how the protein should be, if it's more plant or animal, or should be 50-50. And now we have more clear evidence that more than 50 plant-based protein sources are better and can have favorable benefits on CKD management. And actually, there are some studies that look at that 70% plant-based protein sources was more beneficial. But, as I said, for now, we don't know exactly, but more than 50% should be the goal. And this is also with people with diabetes. In the past, also, we were allowing a bit more protein because those are people also that they need to optimize their glycemic control, and they can't eat a lot of carbs because of that. So if you also cut back on the protein, there's not much left for those people to eat. So this is an older recommendation that now basically fits with, so diabetes or no diabetes, 0.6 to 0.8 seems to be a good range. And also, just for people to know, even though I mentioned last week, we're not going to focus on people on hemodialysis or peritoneal dialysis. But I want to emphasize that the protein needs for those people doing dialysis are higher. We need 1 to 1.2 grams of protein per kilogram per day, and that's because they have more protein losses through the dialysis process. And in order to stabilize their nutritional status, they need that extra protein. So now, talking about the protein type, as I said, new for this year would be that more than 50% plant-based seem to be more beneficial. And also eating less processed foods and less animal meat, type of products, lessens the production of those advanced glycation end products that are correlated with progression of CKD. And then actually, as CKD progresses, also our body makes more of those advanced glycation end products. And I have here a slide about how to limit the production of those glycation and products. So it seems like our body produces more of those when we eat a lot of high fat, high protein animal products, high sugar, and more processed foods. And of course, not eating those foods and not making those foods part of our regular dietary pattern would be helpful. Also, how you cook certain foods can increase the production of those products, and limiting the dry heat and the high temperatures actually can help. So when you think about grilling at high temperatures, that tends to increase the production of AGEs. When you cook with more moist at lower temperatures or for shorter time, you actually, again, this is a way to avoid the creation of those products. So that would be better. When you marinate an animal product, let's say a meat before cooking, that also the acidic ingredients, like in a marinade, you need to put some acidic, like vinegar, lemon juice, or tartar, or tomato juice. And that actually, those acidic ingredients can help with lowering the production of this. Slow cookers tend to help also limiting, so cooking over ceramic surfaces. Regular exercise helps, and also eating more whole foods, plant-based foods, high in antioxidants can also help with limiting the production of AGEs. Now I want to show you step by step how you can calculate the protein that you need for CKD. Again, this is through stages, let's say 3 to 5, because a lot of people may not be even aware they have CKD in the first couple of stages. So you take your weight in pounds and you divide it by 2.2. and you find your weight in kilograms. And then that weight in kilograms, you multiply by 0.6 for that first number of the range of protein. And then you get the grams of protein to eat per day. That would be the lower range. And then you take the weight in kilogram and you multiply by 0.8, which would be the upper range, and you get the grams of protein. Yeah. And I have here an example. A female, 5'5" and 136 pounds. So we divide that by 2, it's 61.8 kilograms, and we multiply that by 0.6, which will round out this number as 37 grams of protein. So that would be the low range. And then we do it, we multiply by 0.8, and we get the 49 grams of protein per day. So basically the daily protein intake should range between 37 and 49 grams of proteins, almost at 50 for this particular woman with CKD. Now, I'm not going to show you how to eat more protein because that's easy, right? But I want to show you certain, we'll come back to this one, but I want to show you how 37 grams of protein may look in a day of eating. And I made it in a way that this is probably 70+% of protein coming from plant-based food sources. So breakfast, 3/4 cup of oatmeal with some honey and 1/4 cup of nuts, plus 1 tablespoon of ground flax seeds and a cup of strawberries. Lunch can be sandwiched with 2 slices of bread, 2 ounces of tuna salad, lettuce, tomato, and mustard, mixed green salad, and an apple. And dinner, a quinoa bowl with 1/2 cup cooked quinoa, 1/4 cup of cooked black beans, and chopped cucumber, tomato, and avocado, and a cup of raspberries. And, basically the only type of animal protein was the tuna salad here. And again, if you look out of I guess we had 5 types of protein foods, the nuts and seeds, the tuna, the quinoa, the black beans, and the bread, just 1 was animal. So it was probably a percentage of 80 to 90 more plant-based. So you have room to put maybe to replace here, instead of a quarter of a cup of nuts, maybe you could do a hard-boiled egg next to your oatmeal. You could still keep the tablespoon of ground seeds, flax seeds here in the oatmeal, but maybe replace this with a hard-boiled egg. Or you could do here maybe chicken salad, or something that's not tuna, but still animal product, or maybe, yeah, something dairy related if you like dairy products. So there are variations of this, but I want to kind of show you how more than 50%, in this case, probably it's even more than 70% plant-based protein, limited protein of 37 grams. And remember, this is the lower range. I mean, you could add a bit more protein and eat more protein as long as you stay between 37 and 49 as a range. And I want to go back to show you some of the protein foods and the grams of protein that's in different servings. You know, for any 1 ounce of fish or meat or poultry, we have 7 grams of protein. There also any cup of milk or yogurt or an ounce of cheese, that's also 7 to 8 grams of protein. Usually starches like bread, pasta, rice, you know, those have some protein, but not too much, but they can add up depending on how much we're eating. So a slice of bread can have somewhere between 2 to 3 grams of protein. Some will have more depending on what's made of. So it's always good to check that nutrition label if you have access to. Again, a 1/3 cup of cooked rice, it's about 2 grams of protein. In a full cup, you can have up to 5. And then, of course, there are things like vegetables that have much fruit and fats like oils and butter. Those do not have any protein at all. And then I have here a list with more specific food choices that we could send it to you if you're interested. Again, an ounce of cheese is about 7 grams. An egg, it's about 7 grams. Half a cup of cooked beans, it's about 7 to 8 grams. I have on this side more the plant-based ones. Nuts and seeds, quarter of a cup. It's about 5 to 7 depending. And the same with nuts or seeds, nut butter or seed butter, like sunflower seed butter. Peas have also in half a cup 4, so they're not as high as beans. If you could look at beans and lentils, there's 7 in half a cup. This is 4, almost half, but still they could add some protein. And then we have tofu in half a cup, 10. Quinoa, in a full cup, it's about 9 grams, almost 10. So it's almost double. I want to point that out for people who want to go more plant-based. So quinoa, it's a great grain. It's actually a seed, but has more carbohydrate than seeds. So that's why we put it in the gray category, because it's also starch, but definitely it's higher protein content in quinoa than any other grains. And you could see it's almost double. So moving forward, so this was the idea about, this is the kind of story with the protein so far. The key points would be not too much still, like 0.6 to 0.8, but we're not super restrictive with it. And the most important thing is that more than half of that protein to be coming from plants. Sodium, it's another nutrient of concern, and it's naturally present in a lot of foods, and we actually need sodium on a regular basis, but it's more about how much, right? So we need some sodium. Salt is the major source of sodium. And in the salt, table salt, we have about 40% sodium and 60% chloride. So not all that salt, it's sodium. So salt and sodium are not completely equal. This is what I'm trying to say. Usually the salt does not translate 100% into sodium. The salt has sodium, but about maybe half of the mineral, and the salt is sodium, and the other half is chloride. You have here some conversions. I don't know if they're helpful. People sometimes don't really calculate, but just as a visual, I want to point out this 1 teaspoon of salt equals the 2000 milligrams of sodium that we recommend on a low sodium diet. And I want to show you this slide because high sodium diets tend to be increasing high blood pressure, right? When we eat too much salt, we also kind of retain more water in our body, and that can increase the volume of blood and can build pressure in our blood vessels. Also, it's been shown that sodium on its own, when we have too much available in our bodies, can actually stiffen our arteries to the point that, you know, our blood vessels, arteries should be more flexible, so elastic, what we call. And if they start harden and become more stiff, it's easier for that pressure to build in our arteries. So think about the pressure in a garden hose, right? If the hose would be more elastic, we would not have pressure at the end of that hose, you know, to water our plants. So I like to think of hoses as our arteries, and then the stiffer they are, the more you actually build the pressure in those vessels. And that can, as I explained last week, when you have a lot of pressure coming into those small capillaries and blood vessels that are in the kidneys, remember that glomerulus picture I showed you that has those very small blood vessels and looks like a sieve. So when you have a lot of pressure actually coming in, and those can actually break and get damaged. And then as we have kidney damage, the kidneys cannot really perform their body function and cannot remove waste and extra fluids. And basically you build up more fluid in your body and in your blood vessels, and that can feed this cycle, because that creates high blood pressure even more. And then you create this vicious cycle of high blood pressure affects your kidneys, and the kidney damage can affect and can feed into increased blood volume and blood pressure. So sodium can be part of that picture. It's not everything, but definitely too much sodium does not really help this picture at all. And in terms of recommendations, we have, we need to limit sodium to 2000 milligrams a day or lower. So it's not about not having at all sodium. As I said, we kind of need some in our cells, and then it's all about how much we're having, right? Regular table salt, sea salt, and kosher salt. There's so many types of salt right now, but they're kind of equal when it comes to sodium content. So people sometimes say, oh, but I have sea salt or Himalayan sea salt, and that's better. In terms of sodium, it's not. What I find it more helpful is when somebody tells me, oh, this Himalayan salt, I feel like it salts better, and they use less salt because of that, right? So if that's the case, I would say, yes, switch to a different salt. If you feel like salt's better your food and it makes you eat less or use less, that's kind of a win-win situation. We recommend to actually avoid using salt substitutes like light salt and no salt, because those products actually contain potassium chloride instead of sodium chloride and as an ingredient. And as you would see, potassium is one of the nutrients of concern, and depending on your stages and your lab work, that may not be actually a good long-term kind of option for you to salt your food with the potassium chloride. So try avoiding salt substitutes. And what do you use then? What do you do? So I want everybody to be aware of the fact that what are the high sources of sodium in our diet? And I'll tell you, about 75% of the sodium in our diet comes from processed foods, fast food, and restaurant food. Even fine dining restaurant will still use more salt than you would use at home when you cook. And the restaurant cooking uses a lot of pre-made things or bases that they use either for a sauce or for a soup, and those are high in sodium. So it's really hard when you cook in batch and you cook for a lot of people to actually not use those products that are high sodium. So that's why any kind of restaurant eating, regardless if it's fast food or fine dining, will likely have more sodium that you would like. So limiting how often you eat out, maybe once or twice a week only seems to be a good option versus most meals or half of my meals to be out. And then processed foods, anything that has a package, not anything that comes with a package is necessarily processed or high sodium. But when it comes with the label, you could actually read the label. And I have here at the bottom, always read the nutrition label and ingredient list, and that will tell you a lot about that food. So anything that's packaged, some are highly processed and they're very high in sodium, and some are not and there can be good options. But in general, the recommendation, if you eat more whole foods, less packaged foods, and if you cook more at home, that will save you quite a bit of sodium and can actually make that budget of 2,000 milligrams a day more realistic to achieve. So there's a lot of sodium in most frozen and canned foods, but there are lots of canned foods nowadays that do not have salt, like especially canned beans or canned vegetables. There are lots of brands that now they have a no salt added option. Some are having just 50% less sodium or less sodium, but some are just no salt added. That means there was no really salt. They can it in a way that did not really use salt as preservative. So those are definitely the best options when it comes to canned food. However, a prepared food like maybe, I don't know, canned chili, or canned, soups, likely will have sodium and likely will have quite a bit. They might have options of lower, less, reduced, but probably they still gonna have, you're not gonna find a cooked food that has no salt added. It's pretty hard to find those. Smoked and cured meats, those are also high in sodium. Any kind of processed meat, deli meats, salami, prosciuttos, deli turkey, bacon, sausages, ham. Those, if you look at the sodium content, it's pretty high, usually in the 500 milligram per serving or even sometimes higher. Most cheeses are higher in sodium because the process of making the cheese kind of involves that. But again, those things come with a package, and you could look and pick different brands, different types of cheeses, and choose the ones with less sodium. Cheeses usually have less sodium than processed meats. They might be in the 200, 300 milligrams per serving area. Pickles, sauerkraut, olives, those fermented foods tend to be high in sodium. So portion control, the fermented foods have a beneficial effect on our gut microbiome. Sometimes there are foods that we recommend people to have, but it's all about how much, right? Using the pickles or the sauerkraut as a condiment to a meal, not, half a plate kind of thing. Most soups and salad dressings, especially again, if you buy in a restaurant or if you buy canned or already prepared at the grocery deli counter, those would be high in sodium likely. Most commonly, commercially prepared sauces, condiments, and seasoning, or, sometimes you buy in a store fresh meat that's marinated, so it comes already with the sauce and marinade, but those are usually pretty high sodium. And I always tell people it's better to marinate your meat or chicken at home. In a Ziploc bag, you just put a bunch of herbs, and you put something acidic like lemon juice or vinegar. You put something like olive oil, you need some fat, and you need herbs and spices and garlic, and not that much salt. But in something that's a marinade already, kind of a piece of meat marinated, it's gonna be way higher in sodium than what you can get at Unfortunately, also many breakfast cereals and breads, sliced breads. I mean, there are sliced breads that can have between 200 to 300 milligrams of sodium per slice. So think about in a sandwich, you get the amount of sodium like 500 to 600 milligrams. And if you put any processed meat or cheese in that sandwich, then you get the sandwich can have easily over 1,000 milligrams of sodium. So I would say read the nutrition labels. A sliced bread will have a nutrition label, and that will tell you, because there are plenty of sliced breads that will have maybe 50 milligrams of sodium per serving, or, you know, something definitely less than 200 to 300. How to read the label. You want to start with the serving size at the top and understand those numbers are going to be based on what they tell you it's a serving. So if I read this label correctly, I'll say in 6 crackers, I will get 180 milligrams of sodium, or 8%. And again, this will be my decision. Is this high, is low? It's kind of in between. The definition of low sodium is 140 milligrams or less per serving. And ideally, this percentage would be 5%. However, you know, this is not those 6 crackers. If I eat them, they're not going to be high sources of sodium also, like, because it's under 200 milligrams. And usually high sodium is 20% or more here in the percentage area. So, you know, it's kind of in between. Can I find maybe a better option? Probably I will if I'm looking at different labels in the store. But this is how you read the nutrition label. And I want to say the rule of thumb is 5% or less means low in that nutrient. So you want that next to sodium, 5% or less. 20% or more means high in that nutrient. So you don't want that for sodium, right? You maybe want that for fiber, for dietary fiber, we want 20% or more. Or we don't want that for sodium or for saturated fat. We want the 5% or less for those. Also, you could read the ingredient list, which can tell you the order of ingredients. It's from the most abundant, the one with the heaviest weight in the product, to the least. So here we see whole wheat, soybean, and palm oil, and salt. So salt is at the end. That means it's not a super salty type of product, and yeah, 8% is not that bad, as I mentioned. But you know, sometimes you'll see salt as the second or the third ingredient in something that's probably 20% or more. So this is a way to double check. Moving forward, I have some, instead of this, you could try that. And you see there's a lot of seasoning with salt, including just table salt, but also garlic salt, onion salt, celery salt, meat tenderizer, bouillon cubes. Those are all kind of high sodium products. But on the right side, you have just condiments that can help you get the good flavor for your food without adding salt, like fresh garlic, onion, garlic powder, onion powder. Those are salt-free, but they help with the flavor. Lemon juice, seasoning blends like Mrs. Dash. It's one of them that's a salt-free seasoning blend. So they have something like chipotle, for example. They have different herbs and spices that create the taste experience, but they don't add any salt in their seasoning. And then vinegar can be also used. High sodium sauces would be those ones: soy sauce, oyster sauce, fish sauce, steak sauce, and barbecue sauce. And something like vinegar or dry mustard or homemade, right? Like the ones you make and you know what you put in them. Or even if you put salt, you don't put that much, and you have that 100% control over sodium. Cure foods, as I mentioned, they're high in sodium, and then the fresh alternatives will be better choices. So instead of smoked salmon, you can just have fresh salmon. Instead of bacon, you could have some pork or pork belly. Canned foods, soups, juices, vegetables. Again, a lot of vegetables, if they're non-salt added, they're not high sodium, so those can be good options. And of course, any kind of homemade soup will have less sodium than a restaurant alternative. So ways to decrease sodium, avoid processed foods, read nutrition labels when you buy something that comes in a package, limit eating out, cook more often at home, use herbs and spices and less salt to season foods. Often we want the acid finish with salt, but we can get this from vinegars and lemon juice. So a lot of times adding those to certain foods can be helpful. Making your own condiments at home that tend to be high sodium, that's helpful too. And again, buy low sodium, reduce sodium, or even better, when available, no salt added canned foods or other products. And I have here, and it's important to mention, rinsing in water things that are canned and have reduced sodium or regular sodium can actually help to decrease some of that sodium. It's not clear how much you can eliminate all of it, but it seems like you could get rid of some of that sodium when you rinse a canned vegetable or food. Of course, like I also give this tip when some of my clients, if they're older and they don't cook that much for themselves, they might buy canned soups. And I tell them you could empty a soup, put more water, maybe chop some carrots and onion and just bring it to a boil, and you use that canned soup as a base, but you dilute it and you add more water and you make more portions out of that. And that's a way to kind of decrease the amount of sodium in a soup. Will still involve some cooking, but not necessarily from scratch. And it's a nice compromise for some of my patients. Now I'm gonna move to the potassium. The role of potassium, it's a mineral, it's an electrolyte in our body, and keeps a normal water balance and helps with muscle contraction. So those are the main roles. And the potassium works with sodium, kind of, we have at every cell this potassium sodium pump that the movement of potassium and sodium in and out of the cell regulates actually where the fluid goes, you know, in our cells, between cells, in our bloodstream. So really helps with that fluid regulation. And as I said, also muscle contraction. And the kidneys remove excess potassium. So when our kidneys work well, we could eat as much potassium as we want. Your kidneys will just excrete that. But as you have CKD and your CKD progresses and your capacity of your kidney is decreased, actually potassium may accumulate in your blood. And again, higher than normal potassium can create irregular heartbeat and make your heart stop, like cardiac arrest. So it can be a life-threatening kind of situation, abnormal potassium, and it can happen when potassium is too low, and it can happen when potassium is too high. With CKD, usually people tend to have higher than normal potassium. And, you know, if you've had labs and you had higher than normal potassium, you should check with your doctor what's a safe potassium level for you. For most doctors, 3.5 to 5, it's a normal one. Caution between 5.5, and then more than 5.5, it's kind of dangerous. So when we have hyperkalemia, which is the condition when your blood potassium is too high, people may need to restrict potassium, right? And again, not necessary to avoid completely because it's impossible. It's in a lot of foods, but limiting to maybe 2,400 milligrams or less a day. Sometimes we use the 2,000 to 3,000 range, or 24,000 or less. But that should be also case by case. So what I wanted to mention is there are sometimes other causes for high potassium that are not diet related, does not have to do with how much potassium you're eating from foods. Blood pressure meds, uncontrolled diabetes, acidosis, chronic constipation, they can all affect your blood levels of potassium. And some diuretics can decrease potassium and some can actually increase. So some are potassium sparing and some are kind of make you lose potassium. And if you have high potassium, you need to talk with your doctor too and look at your medication and other possible causes before you restrict even further your diet. Those are some high potassium foods that you can absolutely enjoy in moderation. You know, fruits and vegetables, other foods like beans and meats and fish and milk and yogurt, dry fruits. So there, as I said, high potassium foods, they're quite a bit and they're different groups. So it can be animal-based foods and can be plant-based foods. And it's not about not eating them. A lot of my patients talk to me and say, oh, because I have CKD, I cannot eat bananas or avocados. And that's not true. First of all, even if you have CKD, you don't need to restrict potassium if your labs are normal. Even with people, as I said, with abnormal potassium, you have to look at other causes and you have to kind of weigh in how much restriction do you have from a dietary standpoint. So, and then with this plant-based diet focus, it becomes even more important to understand that lots of foods are high in potassium, especially plant-based foods, and there are different bioavailability of potassium in different foods. So in fruits and veggies, only about 50 to 60% of the potassium is absorbed. In animal foods, about 80%, so much more. And then in processed foods, all those salt substitutes that I talked about, the potassium chloride or the food additives that are and preservatives that are used in foods, processed foods like potassium citrate, it can be one of them. All those, like 100% of that potassium is absorbed, so highly absorbable. So you really wanna, when you look at the dietary restriction of potassium, you really need to start with those bottom ones, you know, with the processed foods and with the animal foods. And I don't want people to avoid eating avocados or bananas or, you know, apricots or beans because they're high in potassium. And because those are plant-based foods, and actually the plant-based foods are the only foods that naturally have fiber in them, right? We have fruits, vegetables, whole grains, nuts and seeds, and legumes. Those are the only 5 categories of naturally occurring fibers. And those are plant-based foods. So the plant-based foods have more fiber, and that increases actually the intestinal potassium excretion. So you usually, potassium binds with those fibers and phytates in those plant-based foods, and you kind of eliminate. That's why they're not very well absorbable, because you eliminate some of it and they're not absorbing the potassium as much in the blood. And actually, they look at some studies and did some studies on people with CKD, even stages 4, with the GFR less than 30. And they noticed that a plant-based diet is not necessarily considered to increase the risk of hyperkalemia. You know, there are usually different factors that affect that potassium level. And again, unfortunately, most educational materials and online resources still recommend restricting fruits and vegetables, but those should not be the first ones to restrict. You want to look at meds, you want to look at, again, processed foods, you want to look at animal foods. And as a last resort, if needed only, you might restrict some of those plant-based high potassium foods. And even not restrict, like not have it all, but maybe in moderation, limit the portion size or something like that. So I really don't want any of my CKD patients to have those no-nos. You know, I met with so many people that just tell me, oh, I can't have banana, I can't have avocados, I can't have tomatoes, I can't have spinach, I can't have they're completely avoiding those foods without actually, and not just it's not needed, but it's actually detrimental to your health because you're reducing those plant-based foods that are actually helping your CKD. We're going to move to phosphorus, and I'm really hoping today to have more time for questions. So to go through my slides a little bit faster, maybe we'll have another 15 minutes of slides and then we could take questions. But moving to phosphorus, the role in the body is to build healthy, strong bones, the main role. And again, the kidneys remove excess phosphorus, and in CKD, because of inability to remove that, the phosphorus may accumulate. And we talked last week about this cycle that high phosphorus creates this low calcium in your blood. It triggers this high parathyroid hormone, and that pulls more calcium from your bones as a way to increase the calcium in the blood that decreases, and that weakens your bones. So high phosphorus levels can weaken your bones. And then high phosphorus in your blood also, unfortunately, can lead to vascular calcification and increased risk of cardiovascular events. So we don't want more than needed of this phosphorus in our blood for those two main reasons. And again, we could limit the dietary phosphorus in people that have high phosphorus lab results. Again, not everybody with CKD needs to limit phosphorus. If your levels are kind of higher, you may need to limit, but it needs to be, again, an individualized approach. Because there are other options to, like phosphate binders that you might be able to take with your foods. But what I wanted to say at early stages, I still recommend, even though your phosphorus is normal in your blood, I still recommend to avoid the more, the processed foods that have phosphorus containing additives. A lot of stabilizer, preservatives, color enhancers, you name them, those food additives actually contain phosphorus. They're phosphates. Might be calcium phosphate or sodium phosphate or different kind of versions, but they're all going to have that phos or phosphate word next to it. So you can actually spot that on an ingredient list and know. Dark colas like Coke and Pepsi, they have phosphate in them, and again, a lot of processed food. So I actually recommend, even at early stages, to remove those phosphate additives as much as possible from your diet and avoid them. As GFR reaches 15, again, phosphate binders may be necessary. And basically, if you absorb, they kind of bind, the phosphate binders, that's what they do. They bind with the phosphorus in your gut and kind of gets flushed away. So it doesn't get absorbed into your blood. Sources of phosphorus in your diet. So foods rich in phosphorus are usually protein foods. Can be animal protein foods or can be plant-based protein foods. So they're meats, dairy products, but also dry beans and peas and whole grains and nuts. Then we have some random foods like beer, chocolate, and colas. As I mentioned, those can have phosphorus. But the colas, those are not natural. They're actually added phosphate to them. The other foods have natural or organic phosphorus in them, and only, again, 40 to 60% of it's going to be absorbed. So those, when phosphorus is naturally occurring in foods, it's not as well absorbed as the one in food additives. However, I have here on the bottom of the slide that the one that's actually the phosphorus from additives, it's the inorganic phosphorus, and that's about 90% absorbability. So way higher than 40 to 60. Also, another thing to mention is that a plant-based phosphorus is less absorbable than animal-based phosphorus, exactly as the potassium. So, and the reason is because also it is bound to those phytates, which are common and are available only in the plant-based foods. And those are difficult to digest by humans. And basically, we don't digest the phytates, and the phosphorus binds the phytates, and they end up in your stool, and you flush them out through your bowel movement, and you're not absorbing those in your blood. So another way to say, I want to kind of go back. What I want to say with phosphorus, exactly as with potassium, if you need to restrict your diet, I would start with food additives and processed foods, even at early stages. And as you, let's say, for people with more advanced CKD that already start having abnormal phosphorus blood levels, I would start looking more at changing that animal protein and replace it more with plant-based protein as an approach. But still, I don't want to restrict at this point the beans or the whole grains or the nuts and seeds. You might want to start a phosphate binder and see with the more plant-based and the phosphate binder how much that helps to reduce the phosphorus. And again, if you really need to restrict more of the plant-based proteins too, that would be kind of the last resort if nothing seems to work. Other nutrition considerations, calcium, we talked last week a little bit about, and it's important to have adequate calcium intake to avoid both low or high calcium levels in the blood. We don't want to exceed 2,000 milligrams of calcium because that can increase more the calcification risk, but we want to kind of get to the recommendation of 1,000. Some people need 1,200. But a lot of some studies show that even between 800 to 1,000 milligrams of calcium a day, it's a good goal for people with CKD stage 3, 4, and will actually give enough calcium, but not excessive, right? And vitamin D, as you may recall from last week, it gets activated in the kidneys, and that may not happen as well when kidneys are not working as well. So patients with CKD have increased risk of vitamin D deficiency, and you kind of need to test vitamin D and supplement accordingly. Some people may need to take the active form of vitamin D supplement, so then kind of skip that stage of the kidneys activate the vitamin D, so you take the active form of it. And if blood calcium gets too high, sometimes the vitamin D needs to stop. So it's all about kind of monitoring those labs for somebody with CKD. Anemia can also happen if you remember the hormone erythropoietin. It's produced by kidneys, and that stimulates the red blood cell production. So you want to test and treat accordingly. Again, keep regular labs for anemia. Know what needs to happen. Some people need to take this EPO hormone. Since your kidneys are not producing it, you kind of need to take it in a form of medication. What else should I know? Again, there's no diet that is right for everyone with kidney disease or even kidney failure, and it needs to be highly individualized. What you can or cannot eat will change over time depending on how much of your kidney function you have and whether or not you have other health conditions, right, like diabetes, heart disease. And it's important definitely to work with your medical team closely, maybe talk with a dietitian to just get that individualized meal plan or dietary advice. As I mentioned, and this is just kind of to summarize today, I see more often people being more restrictive than needed. and not focusing on the right thing, just because, again, if you do a search online, kidney diet, it's going to be overwhelming. And again, you're going to restrict actually the foods that may be helpful, those plant-based foods. I really think that at this point, with the level of evidence that we have, people should not restrict the intake of plant-based foods like fruits, vegetables, whole grains, legumes, nuts and seeds, even at more advanced stages. And I'm not even talking about stage 3 when most people have normal labs, and there's really no reason, even before, when we had less evidence and less clarity on the plant-based diet, even before, I was just like not telling people basically not to avoid fruits and vegetables just because they're high in potassium, since their labs are normal. No reason to do that. And I wanted my last slide before my references is this one that I found appropriate to put in, because as I said, next week, we're also going to have a speaker talking about more of the plant-based diet. And I want to show you, because I liked it. I found it in a study, and I liked the way it kind of, the breakdown of the benefits of a plant-based diet for CKD. So plant-based diet means low animal protein and more plant-based protein. And then the first kind of benefit is that the plant-based diet is high in fiber. And that fiber actually can correct any imbalances in your microbiome that can happen, right? This gut dysbiosis is basically an imbalance in your microbiome. And by correcting that imbalance, that helps actually decreasing the uremic toxins. The uremic toxins actually, when you have more uremic toxins in your body, you increase the risk of CKD progression and cardiovascular events. So it's correlated with that. And many uremic toxins are derived from, byproducts of aromatic amino acid breakdown by your gut microbiota. So tends to be formed more from animal-based type of protein. So that's one way how your plant-based diet can be helpful for somebody with CKD. The second would be the intestinal phosphorus absorption decreases. So as I mentioned, basically the plant-based proteins that are also good sources of phosphorus, they can bind with the phytates that are naturally occurring in plant-based foods, and that can decrease the intestinal absorption of phosphorus, will eliminate the phosphorus instead of increasing or absorbing it in the blood. That will decrease the blood level of phosphorus, and that will decrease the vascular calcification risk of cardiovascular events, because I mentioned earlier that high phosphorus level in your blood can increase the risk of vascular calcification. So, and we know that CKD and cardiovascular disease, the kind of higher, when you have CKD, higher risk for cardiovascular events, and cardiovascular disease too can kind of in a way worsen the CKD. The plant-based diet also decreases the dietary acid load, because as I mentioned, the plant-based foods are more alkaline or alkali producing, and the animal-based foods produce more acid. So when you eat more plants versus acid, versus animal, you decrease the acid load, and that actually can help with metabolic acidosis that can happen in somebody with CKD. So decreased dietary acid load can decrease the risk of metabolic acidosis, which is actually a risk factor for CKD progression. And this is important because a lot of you maybe have already or know somebody with CKD. And as we talked last week, this is not reversible, but can be stopped or very much slowed down or stopped. And this is what we're trying to do. With all those things you don't want to have the CKD progressing, right? And those things that I mentioned so far with the plant-based diet can actually decrease the risk of the CKD progression. Another one that another effect of the plant-based diets can be decreasing the glomerular hyperfiltration. So basically, the plant-based diets are less likely to induce this glomerular hyperfiltration, which actually happens when you build up a lot of pressure in those glomeruli, those sieve mechanisms that filtrate the blood that goes through the kidneys. So less pressure and less hyperfiltration translates into less protein in the urine and translates into less risk of CKD progression. And then the last one is actually the plant-based diet increases magnesium in your diet, because a lot of good sources of magnesium will be whole grains, nuts and seeds, leafy greens, some more plant-based foods. And actually more magnesium can decrease the vascular calcification. And some experimental evidence shows that the magnesium inhibits the calcification of the vascular smooth muscle cells. So basically decreases the calcification that, remember I said, high phosphorus can increase that. So kind of counterbalance the effect of high phosphorus. So seems to be, even though it's not, I think, 100% established, as I said, some experimental evidence shows that those foods high in magnesium can be beneficial for this mechanism that will decrease the vascular calcification. So all those are benefits of the plant-based diet to decrease the CKD progression. And I think this is it for today. We have a little bit over 15 minutes to answer questions.
We have about 8 questions, so hopefully we get to all of them. Feel free to defer any of these to next week if they make more sense to share with the topic next week, which is meal planning and sustainable approaches to CKD. Also feel free to jump in, Franco, if you have answers. As a reminder, our first question has some information about over-the-counter medications that are okay for CKD. As a reminder, all of the information shared in this discussion is not medical advice. If you are seeking medical advice, please reach out to your primary care doctor. So the first question is, they're looking for a list of over-the-counter medications that are okay for CKD and a list that are not okay for CKD. I'm not sure if this is something that we can share.
Yeah, what I will say, I can say something in general sense that there are some things to think about before you even begin to think about taking any type of medication. We know that some of the pain medications, especially aspirin, some of the non-steroidal group like naproxen and ibuprofen, when they're used for long periods of time, can cause kidney issues. So make sure that you double check with your physician, your healthcare team. Also, one of the things that we have to also kind of keep an eye on is heavy alcohol use can over time cause kidney problems in a big way. So moderation is always a good practice. And then lastly, some antibiotics. Again, make sure that you're checking and consulting with your physician, your healthcare team. And lastly, some laxatives that sometimes some of us take when you're having digestive issues. So keep an eye out for those, because those are the most common ones that are over the counter in some cases. But again, make sure that you double check with the healthcare team before you take any of those groups of medications for extended period of times.
Yeah, and I personally don't have a list of over-the-counter medications that you can or cannot have. If you have CKD, this is definitely a good question to ask your doctor, nephrologist, ideally, or is more like nursing. Sorry, but medications are not my, my specialty. So I can't really give advice around it.
Thank you, Franco and Elena. This question has a few parts to it, so I'm going to continue and then we can move on to the next questions. They asked if it's okay to eat various nutrients if blood levels show that it's okay. For example, potassium, which I think we discussed a bit in the presentation.
And it's totally okay. Yeah, totally okay. Actually, highly encouraged.
Great. And then which vitamins or supplement levels to work to keep in normal parameters? I think we discussed this a little bit as well, but if you don't mind going over it, Elena.
Yeah, so definitely vitamin D and calcium, the PTH, the parathyroid hormone, because that will kind of help you manage, the whole phosphorus, calcium, vitamin D picture. So the question was lab values more that can pertain to nutrition, right? The ones, again, for anemia, so CBC, blood count, to figure out if you have anemia, and then maybe more descriptive of iron, vitamin B12. We could just kind of figure out, what kind of anemia? A lot of times with advanced stages of CKD anemia, it's because of that inability of kidney to produce the hormone erythropoietin, but sometimes there are other, also hidden reasons, like, as I said, more micro or macro deficiency anemia happening. So those are some of the labs that I would say need to be checked from a nutrition perspective. And usually if you're followed by a nephrologist, they're gonna monitor that along with creatinine, GFR, and all those kidney function kind of levels, the albumin creatinine ratio. Just that would be to assess, your kidney function and to keep an eye on the progression or no progression of CKD.
Great, thank you, Elena. Moving on to our next question. Can you discuss nutrition for stage 3 CKD?
Yeah, so really at stage 3, what I said, just the plant-based diet, Mediterranean diet, with no excessive protein. Again, you could be more at the 0.8 grams of protein per kilogram body weight, like a higher level, but I would not go excessively high with protein. And kind of at that level, I would definitely try to create healthy habits around how can I make myself eating more plant-based foods, practicing that my plate model of eating that I showed you, and it might not be 80-90% of the time, maybe 70, but I have time to work on it and improve that. So I encourage people to definitely stir more towards a plant-based diet. They don't have to restrict any foods per se. Again, monitor the amounts of protein. And on that My Plate model of eating, the protein, remember, is just a quarter of a plate. It's a small amount of protein. So even when you have animal protein, it's not going to be too much, because that's kind of the model, the ratio on the plate that's promoted through this diet. So following that, increasing exercise, making sure you stop smoking or drinking alcohol if you drink a lot. So alcohol in moderation, it's fine. A serving of alcohol for women and 2 servings maximum a day as for men. So I would just use very basic, healthy lifestyle eating recommendations that are for healthy individuals, and not really much more than that. Just making sure, as I said, I'm getting comfortable with those eating patterns, and that can be enough to, again, stop the progression of CKD. Of course, if you have diabetes or high blood pressure, making sure everything is well controlled with medication and diet as needed, doing regular checkups with your doctor to monitor those labs and make sure everything is kind of stable. And that's usually what I would recommend for stage.
Yeah, if I can just reemphasize and underline what you just said in terms of the self-management of diabetes and high blood pressure are super important. As much as we try to focus a lot on our nutrition, that's a big component of that self-management for those two conditions. And if we understand what control actually means in the terms of diabetes, making sure that your A1C is under 7, making sure that your blood pressure, in the case of hypertension, that is under 130 over 80. And if you have reached those two goals in your everyday checkups, then you're doing a fantastic job of managing and controlling your diabetes with your physical activity, hopefully, and the nutrition practice that you are putting into play every day. Very important to
and I
remember.
like that more self-monitoring too, because I actually had a patient more recently, but he didn't have CKD, but he had some pre-diabetes, high cholesterol kind of history. And he was telling me that, because his labs from 1 year to the other improved, or 6 months ago to now improved quite a bit. And then he kind of told me that basically, I really, because I knew I'm going for labs, and I fasted like for 2 weeks or something and really watched his diet. And, it's something that I say, and the labs were much better, but that's also kind of shows that, yeah, you respond to those, but if you can't sustain it long term and for another 6 months, then you reverse and not have a good diet. And even if you don't check the numbers, that doesn't mean you're healthy, right? And each time you check, you're doing your best to, lose weight or fast or diet, so that the labs look good, but that's not really, a good sustainable, and that doesn't give you an accurate picture of how you're doing on a daily basis. But when you have diabetes and high blood pressure, if you can monitor those more often at home versus just every 3 months or so at the doctor's office, I think that would kind of give you that reassurance that you're doing the right thing and you're not damaging your kidneys.
Thank you, Franco and Elena. I'll move on to our next question. Can diet play a role in preventing infection?
It's an interesting question. Like preventing an infection, it's probably a stretch to say that. I know like a healthy diet can definitely strengthen your immune system. And that doesn't mean you cannot get an infection in your body, but it means that maybe you're more equipped to handle that infection better. And that infection may make you less sick than maybe if your immunity is not. So it's an interesting question, but I won't say that diet is highly correlated with decreased risk of infections. I think it depends on why the infection happens in the body, and and the only kind of connection that I'm thinking of is that a good healthy diet can strengthen your immunity, and then a better kind of immune response can help more in the case of a infection in your body. I don't know if Franco would have anything.
I would agree with that totally. It just would add that a lot of it depends on your environment, your exposure. But at the very least, if you are eating healthy, nutritious, giving your body all the tools that it needs to keep your immune system up to par and in a good state, I think that gives you a better chance than if you didn't. And so reminding everybody that, nutrition is all about not only the calories, but also getting all the vitamins, all the minerals, and the proper amount of liquids, water in most cases, hopefully, to give your body a better fighting chance to maintain its normal functions, not just for kidney, but other organs as well.
Thank you both. Moving on to the next question. What is a good ratio of carbs, fats, and proteins when eating to preserve kidney function?
Yeah, the ratio, I mean, I know the ratio of macronutrients. Those are the three macronutrients, the only nutrients that give you calories, fat, protein, and carbohydrate. And it will depend of, like, again, do you also have diabetes or not? Because you might have a bit of a different ratio for carbohydrates. I would say the protein should be low to moderate. So that can be somewhere between, somewhere between 12 to 18% of your total calories coming from protein only. But it will depend, because you see this percentage of macronutrient distribution, it's based on the caloric intake in a day, and the calorie intake in a day can be very different from person to person, depending on how tall, how heavy they are, how old they are, if they're men versus females, how active they are. So I can't really say there is a specific distribution of macronutrients for every single person. So it will depend on how heavy you are. It will depend on if you have diabetes or not, and those percentage can be a little bit different. In general, give you a rough estimate, we want 20% protein, about 50% carbohydrate, and about 30% fat. But again, depending on your CKD stage, if you have diabetes or not, those protein may be a bit less than 20. Carbohydrate, they may be a little bit less than, if you have diabetes, a little bit less than 50, maybe 45, I mean, not way less. And then fat may be a bit higher and focus on healthy fats. So again, that individualized approach, it's very important. I can give you a strict answer, but if you are interested, I would say go and see a dietitian 101 that can help you telling you exactly what would be your perfect kind of percentage breakdown of macronutrients.
Next question. Can inflammation in adjacent parts of the body increase chances of CKD?
So yes, there's evidence. So first of all, and I talk a lot with cancer patients and patients from cardiac rehab program that had, cardiovascular events. So they have cardiovascular disease. So in today's society, the main diseases, chronic diseases, are diabetes, cardiovascular disease, cancer, chronic kidney disease. Those are all chronic conditions, and they all have an inflammatory component. So inflammation actually plays a role in all of those. It's almost like they have this inflammatory component at the root of development. So CKD is part of that. There are studies that show that, inflammation in your body can damage more the glomeruli, those sieves, the mechanisms in your nephrons that are formed, are the filtration kind of mechanism. So that can happen. And I think more evidence we have that more inflammation in your body actually can contribute to the progression of. So we have some evidence that can also lead to the development, but I think it's more evidence that we have that can, once you have CKD, if you have more inflammation happening in your body, that can actually accelerate the progression of.
We have just 4 more questions to answer, so we'll go ahead and move on to the next one. Has it become a standard for those with diabetes and high blood pressure to receive kidney checks?
It should be. It should be. They're part of guidelines. And I think that screening happens mainly from PCP, primary care physicians. Correct me if I'm wrong, Franco.
Yes, we mentioned it last week that at the very least, the urinalysis, the sample where we're asked to pee in a cup, so to speak, that is part of your physical examination. So every time you get a physical, hopefully every year, if you're good about it, or at least once every 3 years, you should be providing a urine sample, and that's a urine check. That's checking your kidneys and how they're at that particular time. And then if they see something that is not very good or a little bit off normal, then you do a blood sampling to see what else is happening that the blood chemistry can tell us a lot about it. And then you can go into more definitive type of studies like x-rays and that kind of stuff, depending on what problems may come up. But yeah, a standard check of your urine is part of your physical examination. And if you haven't received one, make sure that your next physical, you ask for one, because that's part of the overall checkup that you should be getting, that you get for your overall health, and just kind of seeing how your body and its different organs are doing. It's very important.
So I think it must be part of the, and I think it is for most part, unless there may be some exceptions, but I think most primary care physicians, part of their annual exam, they screen for, yeah.
Great, thank you both for sharing. Next, is it typical for the elderly to have CKD?
Yeah, and as far as we, for the numbers that we've seen, the most recent ones, I think from the data, we know that there are about almost 40% of individuals above 65 years of age that are living with chronic kidney disease. And as we say, unfortunately, many of those individuals don't know that they have. And so that's why it's important, as we just mentioned in the prior question, to get those urinalysis, blood chemistry done to check your kidney function, because that's important. Again, kidney disease and a lot of other diseases are silent. And if we don't get looked at or examined in some shape or form frequently, then some of those problems can just go along with us not knowing about it, and can end up with problems that are probably worse down the road. So important to have that, and especially some ages, when we get to certain stages of our lives, it's important to have that in mind, and to really get as well some of the screenings that are recommended, not just for kidney but other diseases, for cancer, for that we see all the time, a lot of information that's directed to us in terms of we should be getting a vaccination of some sort as we get to a certain age, or if we have certain exposure, or as we go to certain ages, getting screenings for cancer, especially women at age 35 for cervical cancer, breast cancer, and women, and then for prostate. And so there are certain milestones through our ages that we know, and we should practice those screenings for ourselves, because screening is always a good opportunity to find out where you're at, and if hoping that everything comes out fine and everything is good until the next time. And so that's important to keep in mind as well.
Yeah, and just to kind of make clear is that not everybody that's 65 or plus will have kidney or develop chronic kidney disease, but it's higher, the way Franco said, higher risk, right? 40% of adults 65 plus will have, and also because as we age, our body kind of slows down, is not as efficient at performing all the bodily function. And that's one of the risks too. Plus, there are higher chances you have other chronic conditions that can increase the risk of CKD, like diabetes, high blood pressure tends to develop later in life. And so there are different reasons why it tends to be a higher percentage, but it's not necessary that everybody will develop CKD. So just to be mindful about that.
Thank you both. Moving on, are homeopathic prescriptions or medications okay for use? They find they do not have the same side effects as allopathic medications.
I would say, talk to your physician, your healthcare team for any type of medications or things that you're using as part of your overall treatment and therapy for a particular condition that you have. It's always a good idea to have a discussion, because you never know what prescriptions you may be taking and how they interact with whatever is prescribed by your healthcare team. So very important to have those discussions, and they would be more able to tell you yes, no, or give you further direction in that situation.
Yeah, and just to remember, when we take anything, including food, medication, over-the-counter, herb supplement, homeopathic. I mean, every kind of substance we put in our body will be filtered by the kidneys, and kind of the metabolites of that will kind of be excreted or managed in a way by the kidneys. So you want to be careful, what you're taking, understanding. I think there are doctors that are more open to alternatives and maybe let you give you more like a guidance and let you explore, as long as it's safe. So that's the thing. And I'm the same as a dietitian. I'm trained in more westernized kind of approach, medical nutrition therapy, science-based, but I'm not dismissing, the more integrative part of medicine, which can use more homeopathic or herbal supplements. The thing is that I always look at the risk and benefit assessment. And if it's something that you're taking, and I could do some research and I could say, at least it's safe to take. I don't know how much it's going to help you, but if you want to try it and it's safe, it's fine, as opposed to, this shows that can affect you this way, this way, this way. I don't think it's a good idea, because you might create more harm than benefits. So you have to be careful. And if you have a doctor that you have a discussion like that, I would say possibly, but again, the information on homeopathic and herbal approaches, we don't have a clear evidence that how helpful those can be. And the more you put in your body, the more ways, more chances to interact and with other things that maybe you're taking or foods that you're eating, and just be mindful that everything kind of gets filtered by the kidneys.
Moving on, this person is curious about saturated fat from plants like coconut. Between plant-based saturated fat versus animal saturated fats, does it have the same effect on our lipid levels?
It's an excellent question, and I wish I would have a yes or no answer. Unfortunately, it's a bit controversial. Still, we need more research to actually show. So I can tell you there's a research study showing there's saturated fat in coconut. We know it's about 80% saturated fat in the coconut products, right? And so it's a high saturated fat source, but it's a plant-based source. And some studies show that, well, the saturated fat is not as pro-inflammatory as the animal saturated fat, but in reality is that some studies did not show that, and we really still don't know. What we know as a fact is 80% of it is saturated fat. So I tell people, do not use, for example, coconut oil as your healthy day-by-day cooking oil, because we still don't know if it really affects your lipids at the same level as, let's say, saturated fat from a piece of steak or cheese. So you want to be more careful. If you want to use it once or twice a week and you're cooking for certain dishes, that would be fine. But I would use everyday olive oil, because guess what? All the studies, we don't have any gray area, and all the studies that look at olive oil said, this is safe and it's good for your health type of fat to use. So I would be more cautious with how often and how much.
Thank you, Elena. And we had one last question come. They said you had mentioned the impact of alcohol on kidney health. What are your thoughts about substances such as tobacco and marijuana use?
I can talk a little bit about the tobacco in particular. In tobacco per se has been found to not have any specific benefit to us as humans. So that is, I would say that, that is a bad habit. And if you do smoke, try to, quit the tobacco use in any shape or form. Marijuana is a little bit different. There are some benefits in terms of some conditions, and there's a lot of literature that is coming out, hopefully in the next couple of years, a lot of research that is being done with respect to some of the benefits it has, especially around pain relief. But I think if we're talking about tobacco specifically versus marijuana and alcohol, of the three, tobacco is probably the worst, because I don't know of any benefits that tobacco has in any shape or form to us as in our physiology.
And also not forget that smoking can really affect cardiovascular health, and that can affect kidneys too, because actually it's been shown that smoking cigarettes can really affect, again, the elasticity of the blood vessels, and they become stiffer, you build more blood pressure, and that can affect this way, basically, the kidneys. So definitely smoking cessation, it's one of the lifestyle factors that we talk about when we talk about CKD and kidneys health because of that. And I don't know much about marijuana. I haven't seen any kind of data or information that can be maybe detrimental or not. The way you said, there's some benefits for pain management and appetite stimulation. So maybe for people that struggle with that, the nutrition status for late stages can be beneficial. I'm not aware of any harmful effects the way it would be with tobacco.
Thank you both for sharing. And we did have one last question come in. Do we have time?
2 more minutes, yes.
Okay, great. Why is phosphorus not in nutrition labels?
Yeah, I don't know why. I don't know why historically it hasn't been. There are some actually that list phosphorus, but very little, and potassium too. I think there was a push to add those mainly for chronic kidney disease patients, right? But it never kind of went through. But I don't know exactly why. Back in the days in the 1970s, when the nutrition label was adopted and implemented, I think they just kind of, look at just basic macronutrients and then macro, right? Like protein, carbohydrate, fat. And we didn't have that much about fiber or added sugar back then. They kind of just focused on macronutrients, and then they added certain micronutrients that were more of a concern before, like iron, because they fortify certain foods, or calcium for bone health, whatever was more trendy back then. So I think maybe it was not much of an awareness around CKD and potassium and phosphorus and how those can affect. I'm not sure why. Yeah, but that's a good thing. And I can tell you there were actually pushes to add those two for the nutrition label, but I think so far there's nothing in a law form that's mandatory. Some companies choose to add those nutrients, and most of them would not.
Thank you so much for taking the time to answer that last one, Elena. I'd just like to finish off the meeting by thanking everyone for coming, thanking the National Kidney Foundation for being our partner in these presentations, and our sponsor, Horizon. As a reminder, we have one last session in the lecture series. That'll be next Thursday, August 24th at 3:30, same time, 3:30 to 5 p.m. And that will focus on meal planning and sustainable approaches for CKD. Thank you all again for coming, and have a great night.
Thank you. We look forward to seeing you next week.
Thank you, everybody. Have a good evening.